If you are watching this video right now, chances are something already feels wrong. Maybe you tried to reduce your dose last week, or maybe you even missed a few pills by accident, and your body reacted in a way that scared you. Anxiety spiked, sleep disappeared, your nerves felt like they were on fire again, and you thought, is this ever going to end? You are not alone, and you are not imagining it. This video is specifically for people who are going through exactly this experience, and by the end of it, you will have a much clearer understanding of what is happening inside your body and what you can do about it. To understand withdrawal, you first need to understand what gabapentin is actually doing inside your system. Gabapentin is a medication commonly prescribed for nerve pain, anxiety, seizures, and conditions like sciatica. What it does is relatively straightforward. It calms down overactive nerve signals in your brain and spinal cord. Think of it like lowering the volume of noise in your nervous system. So if your nerves are firing too much and causing pain, anxiety, or restlessness, gabapentin helps slow all of that down and brings things back to a manageable level. Now here's the part that most people do not fully appreciate. Your brain is not a passive organ. It adapts constantly. Over time, when gabapentin is present regularly, your brain begins depending on that calming effect. It reorganizes itself around the medication. So when gabapentin is suddenly reduced or stopped, your brain does not immediately adjust. It reacts. And that reaction, that period of imbalance, is what people experience as withdrawal. It is not a weakness. It is not a failure. It is simply your nervous system trying to find its footing again. Withdrawal is not punishment. It is pure biology. When gabapentin has been present in your system for a long period of time, your nervous system adjusts to it and finds a new kind of balance. Everything calibrates around the medication being there. Then, if the medication is removed too quickly, that balance is suddenly broken. Your nervous system becomes overactive again because it no longer has the calming effect it had grown used to. This overactivity is exactly why people feel sudden anxiety, restlessness, sleep problems, and physical discomfort during withdrawal. It is not just in your head. It is your nervous system trying to recalibrate, and that process takes time. Depending on how long you have been on the medication and what your dose was, this adjustment period can feel mild for some people and very intense for others. That is why there is truly no one-size-fits-all experience when it comes to gabapentin withdrawal. So, what do people actually feel when they stop or reduce gabapentin too quickly? The most common symptom is anxiety, not the normal everyday stress that most people experience, but a deep, uncomfortable, almost physical sense of unease that is hard to shake. Many people also report significant sleep problems. They either cannot fall asleep at all, or they keep waking up repeatedly throughout the night and are unable to get back to rest. Another very common issue is dizziness or brain fog. It can feel like your thoughts are slow, unclear, or disconnected from reality. Beyond these, some people also experience sweating or sudden changes in body temperature, irritability and mood swings that feel out of proportion, nausea or stomach discomfort, and the return of nerve pain or tingling sensations that the medication was originally helping to control. In some cases, especially for people who were taking gabapentin specifically for seizures, there can be more serious risks if the medication is stopped suddenly. This is exactly why you should never attempt to stop gabapentin without first speaking to your doctor. Your doctor understands your history, your dosage, and your specific medical situation. Please do not skip that step. It is one of the most important things you can do for your own safety. Now here is where things often go wrong. The biggest mistake that people make when trying to stop gabapentin is stopping it suddenly, what is commonly known as going cold turkey. Many people do this because they feel better and assume they no longer need the medication. Others do it simply because they run out and do not get their prescription refilled in time. And some people underestimate just how much the body has adapted to the medication over time. But here is what usually happens when someone stops suddenly. Within a few days, symptoms return, and sometimes they return even stronger than they were before. This causes a lot of confusion because people begin to wonder whether their original condition has come back. In many cases, however, what they are experiencing is not a return of the condition, it is withdrawal. Another very common mistake is reducing the dose too quickly without any kind of plan or guidance. Even relatively small dose reductions can trigger noticeable symptoms if the body is not ready for the change. This is why tapering, gradually reducing the dose over time, matters so much, and tapering should always be done under medical supervision, not based on guesswork or advice from the internet. A proper plan, built around your specific situation, makes an enormous difference in how manageable the process feels. So how do you actually stop gabapentin safely? The key principle behind everything is slow, gradual reduction. Your brain needs time to adjust to every single change in dose. So instead of stopping suddenly, the dose is reduced by a small amount at a time, with enough time in between each reduction for your nervous system to stabilize before the next step. This approach gives your body a chance to adapt gradually, which significantly reduces the intensity of withdrawal symptoms along the way. There is no universal tapering schedule that works for everyone. Some people need to taper very slowly over several months. Others may be able to tolerate a slightly faster reduction. The right pace depends on how long you have been using the medication, what your current dose is, how sensitive your body is, and what underlying condition the medication was originally treating. The goal is never speed. The goal is always stability. Because the smoother the reduction, the less intense the withdrawal experience tends to be. This is precisely why working with your doctor or a qualified medical professional is so important. They can create a tapering schedule that is safe, realistic, and specific to you. Please do not try to figure this out entirely on your own. Even with a slow and carefully planned taper, some symptoms may still appear along the way. So the goal is not just stopping the medication, it is also actively supporting your body through the entire process. One of the most important areas to focus on is sleep. Try to maintain a regular sleep routine as much as possible. Even if the quality of your sleep is not perfect during this period, having a consistent schedule helps your nervous system stabilize over time. Going to bed at the same time each night and waking at the same time each morning gives your body a rhythm to hold on to. Hydration is another factor that many people overlook. When your body is under stress during withdrawal, even mild dehydration can make symptoms feel noticeably worse. Drinking enough water throughout the day is a simple but meaningful way to support your body. Light physical movement can also help a great deal. Something as simple as a daily walk or gentle stretching can reduce feelings of restlessness and help your nervous system discharge some of the excess activation it is experiencing. Stress management is equally important. During withdrawal, your nervous system is already in a heightened and sensitive state. Adding unnecessary stress on top of that can make symptoms significantly worse. Finding small ways to reduce your daily stress load, whether through breathing exercises, time in nature, or simply slowing down your schedule, can make a real difference in how you feel from day to day. And finally, tracking your symptoms in a simple journal or even on your phone can be genuinely helpful. It gives you clarity and perspective rather than fear. Many people panic when symptoms fluctuate, but fluctuation is actually completely normal during the tapering process. Seeing that pattern over time helps you understand that the ups and downs are part of healing, not a sign that something has gone seriously wrong. There are certain situations where you should absolutely not try to manage withdrawal on your own. If you experience severe anxiety that feels completely uncontrollable, if insomnia becomes extreme and is significantly affecting your ability to function, if your symptoms are getting worse instead of gradually improving, Or if you notice anything that resembles seizure-related symptoms, stop and contact your doctor immediately. Do not wait. Do not try to push through it alone. Gabapentin directly affects your nervous system, and in certain situations, medical intervention is not optional. Your safety is always more important than any timeline or schedule. Gabapentin withdrawal can feel deeply uncomfortable and sometimes even confusing, because the symptoms it produces often look a lot like the very conditions the medication was originally prescribed to treat. That overlap can make it hard to know what is happening and whether things are getting better or worse. But the most important thing to hold on to is this: it is temporary. Your nervous system is simply adjusting to a new balance, and with the right approach, most people are able to get through this process successfully. The key is not rushing. It is not stopping suddenly. It is not ignoring the signals your body is sending you. And it is always keeping your doctor informed and involved throughout the process. Healing is not about how fast you get there. It is about how steadily you move forward. And your body always finds its way back to balance when you give it enough time, enough support, and enough patience to do so.